Malaria is a serious disease. It affects millions worldwide, primarily in tropical and subtropical regions. This mosquito-borne illness is caused by a parasite. The parasite is transmitted through the bite of infected mosquitoes. Malaria poses a significant threat to global health, particularly in low-income countries. Understanding malaria is crucial. We need to recognize its impact on individuals and communities. The disease can cause severe illness and even death. Its burden extends beyond healthcare, affecting economies and hindering development. By learning about malaria, we empower ourselves. We can take steps to protect ourselves and our community. Together, we can work towards a future free from this preventable disease. Malaria is caused by a parasite called plasmodium. This parasite has a complex life cycle that involves both mosquitoes and humans. Understanding this cycle is key to understanding how malaria spreads. The cycle begins when an infected mosquito bites a human. The parasite enters the bloodstream and travels to the liver. In the liver, the parasite multiplies and develops. After some time, the parasites leave the liver and enter red blood cells. Here, they continue to multiply, eventually causing the red blood cells to burst. This release of parasites into the bloodstream triggers the symptoms of malaria. When another mosquito bites an infected person, it picks up the parasites. These parasites then develop within the mosquito, eventually reaching its salivary glands, ready to infect another human. Malaria often presents with a range of symptoms, making it crucial to recognize them early. The disease typically manifests within a few weeks of being bitten by an infected mosquito. However, the incubation period can vary depending on the parasite species. One of the telltale signs of malaria is a high fever, often accompanied by chills. The fever can be cyclical, recurring every 2 to 3 days, corresponding to the parasite's life cycle within the blood. Other common symptoms include headache and muscle aches, which can be debilitating. Some individuals may also experience nausea, vomiting, and diarrhea. In severe cases, malaria can lead to complications such as anemia, respiratory distress, and organ failure. It's important to remember that early diagnosis and treatment are vital for preventing serious complications. If you experience any of these symptoms, especially after traveling to a malaria risk area, seek immediate medical attention. Section 4. Combating malaria treatment and the urgency of early intervention. Early diagnosis and treatment are key to combating malaria and preventing severe complications. Once diagnosed, anti-malarial medications are the cornerstone of treatment. These medications work by killing the parasites in the blood, effectively halting the progression of the disease. The choice of anti-malarial drug depends on several factors. These include the species of parasite, the severity of the infection, and the patient's medical history. Drug resistance is a growing concern, highlighting the importance of following healthcare provider guidance. Prompt medical attention is crucial for managing malaria effectively. Delays in diagnosis and treatment can lead to severe complications, particularly in vulnerable groups such as young children and pregnant women. Remember, malaria is a treatable disease. Early intervention significantly improves the chances of a full recovery. If you suspect you may have malaria, seek medical attention immediately. Section 5. Shielding ourselves, effective prevention strategies against malaria. Prevention is the most effective weapon against malaria. By taking proactive measures, we can significantly reduce the risk of infection and protect ourselves and our communities. One crucial step is avoiding mosquito bites, primarily during peak biting hours. Mosquitoes are most active during dusk and dawn, making it essential to take extra precautions during these times. Using insecticide-treated bed nets is one of the most effective ways to prevent malaria. These nets act as a physical barrier, preventing mosquitoes from reaching people while they sleep. Additionally, wearing long-sleeved clothing and applying insect repellent containing DEET to exposed skin provide an extra layer of protection. Eliminating mosquito breeding grounds is another crucial aspect of malaria prevention. Mosquitoes breed in stagnant water, so removing standing water sources around homes and communities can significantly reduce their population. Section 6. Knowledge is power, uniting in the fight against malaria. In the fight against malaria, knowledge is our most powerful tool. By understanding this disease, its transmission and how to prevent it, we empower ourselves and our communities to take charge of our health. Education plays a vital role in spreading awareness. By sharing accurate information about malaria, we can dispel myths and misconceptions, encouraging people to adopt preventive measures and seek timely treatment. Collective efforts are crucial for combating malaria on a larger scale. Governments, healthcare organizations, and communities must work together to implement effective control programs. These programs should focus on vector control, early diagnosis, and prompt treatment, ensuring that resources are available to those who need them most. The fight against malaria is a shared responsibility. By working together, armed with knowledge and a commitment to action, we can create a world free from the threat of this preventable disease.